So now we will move on to the nutrition-focused portion of this presentation. My name is Casey Williams. I'm a dietitian at Inland Valley Medical Center and I'm part of the Bariatric Center of Excellence program. I cover 2 West, so I will be up to see you on post-op day 1 to reinforce everything discussed today. A healthy diet after surgery helps with healing, minimizes nutritional deficiencies, preserves lean muscle mass, and maintains nutritional health. We will discuss what to expect while you are at the hospital, post-operative diet, nutritional risks, vitamin and mineral supplements, and label reading. Here are some visuals of what your new stomach may look like after surgery. If you have the Roux-en-Y gastric bypass, your new stomach will be about the size of an egg, only 1 to 2 ounces. If you have the sleeve gastrectomy, your new stomach will resemble a banana, still significantly smaller in size. There are several nutritional risks that may come about after bariatric surgery. This information is not meant to scare you. We want to give you all the facts and resources to prevent severe nutritional complications down the road. First, there are anatomical changes that occur. In both the Roux-en-Y and gastric sleeve, stomach size is reduced, allowing you to eat small portions at once. The Roux-en-Y is a malabsorptive procedure due to the fact that parts of the small intestine are bypassed, meaning that they are no longer used in the digestion and absorption of nutrients. This can put you at risk for anemia, iron and/or vitamin B12 deficiency, and osteoporosis, weakening of the bones that arises with decreased calcium in the body. Risks of protein deficiency and dehydration can also occur due to the stomach only being able to have so much at one time. Now to review the vitamin and mineral supplementation that is required post-operatively to prevent the aforementioned complications. Before I go any further, let me say that all vitamins and minerals need to be chewable or liquid after surgery. If you take big pills, your body will not be able to absorb all the nutrients before it leaves your body, putting you at risk for nutritional deficiencies. Chewable and liquid supplements are quickly absorbed and broken down in the body, giving you the most nutritional bang for your buck. And I recommend that you go out and purchase all your vitamin supplements before you have surgery so they are at home waiting for you when you are discharged. So, first on the list is a general multivitamin. Second, make sure you have a B12 vitamin. This vitamin comes in sublingual form, which means under the tongue, being absorbed right into the salivary glands and into the body. Next, a B-complex vitamin which contains all of the B vitamins needed for overall metabolism, energy, and neurological function. Calcium with vitamin D is a must to prevent bone loss, especially in females. One caveat, make sure to separate your multivitamin with your calcium by 2 hours. The iron in the multivitamin competes with calcium for the same receptor in the body. If you take them at the same time, you won't absorb much of either, leaving you deficient. By giving your body that 2-hour space between calcium and iron, you will absorb all of both nutrients. For the first month after surgery, you will want to take a vitamin C for overall healing and immunity. Fun fact, taking your vitamin C with your multivitamin will enhance the iron absorption. Lastly, at 1 month, it is recommended to start taking an omega-3 fish oil for heart health, skin, and hair quality. One question I get asked a lot is, will I lose my hair? The reality is, you just had surgery, so your body is under stress. Some hair loss is normal and expected. However, there are ways to prevent excessive hair loss and make your new hair grow in stronger. First, limit additional stress. Make sure you have a good support system in place, have enough time off of work, school, etc. to recover and get used to your new lifestyle. Second, make sure you have adequate protein, fluid, and vitamins. Basically, follow protocol. Now, there are several vitamins and minerals that assist with preventing hair loss and promoting strong hair growth. Those are iron, biotin, and zinc. There are several food sources that are great sources of those vitamins, mostly your protein foods, meat, poultry, eggs, soy, and beans. One note on fats. Fat is not the enemy. No fat is not the way to go. Fat has an important part in body insulation, cell membrane composition, and function. So, focus on low-fat products like low-fat dairy, lean meats, etc. Protein. There are several reasons why you would become protein deficient after surgery. First, you may not be feeling hungry or wanting to eat. Second, you may be having nausea or vomiting or taste aversions. What you liked before surgery, you may not like anymore, and vice versa. Also, making poor food choices that are not nutritionally dense. Lastly, the small pouch stomach limits the amount of food you can eat at one time. Protein is very important for wound healing, and surgical site healing, and to minimize muscle and hair loss after surgery. The goal of bariatric surgery is to lose fat mass while maintaining your lean muscle mass. Your goal is to try to get between 60 to 80 grams of protein per day per protocol. Dehydration, or not having sufficient fluids in your body, is another nutritional risk after surgery. Again, the smaller stomach size limits the amount of fluid you can drink at one time. Also, nausea and not feeling well can cause you to not drink enough. Having excessive GI losses without proper replenishment is also something to be cautious of. To prevent dehydration, make sure to get 64 ounces of total fluids every day. I must note, once you are advancing through the post-op diet stages and eating, it is imperative that you make sure and not drink while you are eating. This can 1, fill you up faster so you don't eat enough, putting you at risk for nutritional deficiencies, and 2, can lead to dumping syndrome. Which brings me to my next slide. Dumping syndrome occurs when simple sugars are dumped or passed through the stomach into the intestines too quickly. Drinking with meals can also cause this to happen. What happens is when all those sugars reach the intestines, your body brings in extra water or fluids to dilute the partially digested food, leading to symptoms like rapid heart rate, lightheadedness, diarrhea, nausea, sweating, abdominal pain, and cramping.